Many of us have changed our work and leisure activities because of the pandemic. So for many, new conditions have put a particular strain on our eyes. With us today to share some seasonal eye health tips and solutions is optometrist and vision expert Joseph Allen. Welcome, Dr. Allen.
Hey, thank you so much. It's a real honor to be here.
Yeah, we're happy to have you on. Dr. Allen, how have eye needs changed since the pandemic began?
Since the beginning of the pandemic, some people are spending more time outside, but the vast majority of us are actually indoors in front of things like our computer screens and our cell phones all day. And this changing light demand contributes to things like eye strain and light sensitivity. So we're seeing a lot of people with symptoms of tired, sore eyes earlier in the day, as well as people trying to squint to see things easier and even kind of cover over their eyes and protect their eyes from these brighter lights. So these are just a couple of things that we're seeing.
And what tips do you have for minimizing eye strain and light sensitivity?
I have at least two quick tips I think that are really easy for most people. One of which is consider getting transitions lenses. This is something I recommend for almost all of my patients. These are lenses that adapt seamlessly depending on what type of light environment you're in, whether you're outside or indoors. And they just released their newest generation of transitions extra active lenses that get even darker than any lens they've had before. And they even work while you're in the car behind the car windshield. That's usually a common question I get. Other than this, I also recommend that people follow what's called the 20-20-20 rule. This means that whenever you're on a near device, whether it's your phone, a tablet, a computer screen, take a 20-second break, looking at least 20 feet away after every 20 minutes of this device use. That's going to at least give you some moments of rest to let those eye muscles relax. Otherwise, your eyes may get tired out much faster. So I think those are, again, just two quick things that almost everybody can start to utilize.
That's important to remember, the 20-20-20 rule. Now, Kurt, what types of issues should consumers bring up to their eye doctor?
Of course, mentioning that if you're having any vision problems, like your vision's blurry or you're having vision loss, you want to mention that. But I also recommend that you mention how your eyes are feeling. Are they feeling tired? Are they feeling sore? Are you having problems with bright lights? And are your eyes even feeling dry? These are topics and questions that your doctor's going to want to know about to better take care of you and your eyes.
And what lenses should people choose to help better protect their eyes? Would you say, you mentioned the transitional lenses.
I think transitions are some of the best because not only do they offer 100% UVA and UVB light protection, but they also filter blue light, whether you're outdoors or indoors. So I think they're just simply one of the easiest and best things I recommend for almost every one of my patients.
Okay, and this is a personal one, Doc. Some people, like myself, use eye drops for dry, red, or itchy eyes. Do you recommend using eye drops, or can this have a long-term effect?
No, using eye drops can be really beneficial, certainly in short term, but using them long term is part of our protocol established for treating dry eye disease. I think the important thing, though, is that don't just reach for these drops over the counter and use them. First, it's best to consult a local eye care professional to make sure that you're not treating the wrong thing and that's not a better option or treatment for you.
All right, good to know. Check in with your eye care professional. Thank you, doctor. And for more tips on eye health, visit transitions.com.